My name is Carly Baumann, and I'm going to take you through my SLAP exercises. The first exercise is active assisted range of motion, preferably with a cane, but as that could be hard to come by in a high school setting, a long cylindrical slim object such as a broom handle could also work. The directions that the patient needs to accomplish are flexion and extension, abduction and adduction, and external and internal rotation. This exercise is good to help reestablish pain-free range of motion, and it is a good exercise to complete early after surgery. In order to perform this exercise, the unaffected shoulder will pull or push the affected shoulder and kind of just move it as the affected shoulder guides along the motions. Advancement from this phase is full passive range of motion. The take-home exercise for phase 1 is pendulums. You will just lean over a table and move your shoulder clockwise and counterclockwise in circles about 4 to 5 inches in diameter. 10 circles each direction for 3 sets. The goals, again addressed in this phase, are reestablishing pain-free range of motion, while advancement criteria is full passive range of motion. The first exercise of phase 2 is manually resisted internal and external rotation at 0 degrees of abduction. This will be done by the clinician just performing manual resistance in each direction, and you can increase resistance as time progresses throughout the rehab protocol. This exercise addresses increasing muscular strength, and the advancement criteria for this phase is full, non-painful, active, and passive range of motion. The take-home exercise for phase 2 is prone rows. The patient will be lying prone on a table. This could be done on a couch or a bed, and they will bend their elbow and lift the weight to the sky. They can use different weights as needed, and at home you could use any household object that gives you the appropriate amount of weight. It is important to keep the elbow close to the patient's body and be slow and controlled in their motions. The goals, again, that this phase addresses and the exercise addresses is enhancing muscular strength. The advancement criteria, again, full, non-painful, active range of motion and passive range of motion, as well as 4+ out of 5 strength and rotator cuff and deltoid muscles. Phase 3 will begin plyometrics, and this exercise, it's a reverse throw from the clinician to the patient. Patient half kneeling on the ground, the knee opposite the affected shoulder is the one that is raised. The clinician will just toss a ball or an object from behind, and the patient will catch it and complete a diagonal pattern across his body. Weight can increase as time progresses. The goals addressed with this exercise is enhancing neuromuscular control. Advancement for this phase is full range of motion with no pain and a good clinical exam. This will help them determine when they can begin the return to play process. The take-home exercises for phase 3 are going to be ball tosses. This can be done with a med ball, but at home it's understandable that that might not be available, so any sort of ball that the patient has access to will be sufficient. This will help. This exercise addresses enhancing strength and neuromuscular control while getting closer to sport-specific exercises. To complete these exercises, the hip rotation, you'll start with the ball at the hip of the affected side. Use your core and trunk to get full rotations and toss the ball to the wall. The next exercise is a chest pass, two-handed. You will hold the ball at the chest and use both arms to toss the ball to the wall. Again, these exercises both address enhancing strength and neuromuscular control, and the advancement criteria is full, pain-free range of motion and a good clinical exam that will allow them to begin return to play protocol.